So how do you take a history? Well, there's a lot of assumptions in that statement, and the truth is that history taking is an art form of its own. It takes years and years of intentional study to be taking a proper history. But as a first aider or a student or a paramedic or a doctor in the emergency setting, a history of now current events is far more important than everything else that we could potentially hear or get from a patient. In paramedic school, you learn something called SAMPLE, which is a acronym for S is for signs and symptoms, A is for allergies, M is for medications, P is prior history if there's something else wrong, L is for last meal, and E is for events. So these are a couple of questions that you could ask any patient or anyone who's unwell to try and work out what's wrong. But really what it comes down to is that we want something that's called a focused history. What I mean by that is that we don't really care what's happened vaguely. We want to know what the problem is now. Because oftentimes we will see something wrong with someone, and when we get to their home or we get to the accident and it's actually something else is wrong, not what we think is wrong. Sometimes we as healthcare providers can be distracted by what we think is wrong. A good example of this is that you get to someone's house and you can see that they're really struggling to breathe. And you go, well, there's obviously a breathing problem, and you get to them and they say, well, my foot's really sore. And you're kind of thrown back by that because you're like, well, but you can't breathe very well. And he's like, no, but that's normal for me. So his breathing is not the problem, his foot is the problem. And we need to be focused on what the problem is now. And yes, obviously his breathing is an issue, but he's probably on medications, he's been diagnosed, and he knows what's wrong with it, most likely, because it's not new to him. History is important. And if you're going to take a history, yes, you can follow something like SAMPLE. But for me and in my experience, the one thing that I have learned is that we need to ask the question of, why did you call me? So as a paramedic, I can ask, why did you call me? As a first aider, I guess you could just ask, what is wrong? Do you need help? And by asking very simple questions and just letting them answer their question, kind of one of the other rule of thumbs of taking history is don't interrupt. Let them talk. You ask a question, let them finish answering so that you can get a picture. Once you get a picture of what is happening or what is wrong, then you can be more direct and more specific about your questions. So if you say, why did you call for help? Because you get to their home and they say, well, I'm not feeling well. I've been vomiting. And then you go, okay, how long have you been vomiting? Is this the first time you have vomited? And so you have that sort of range of questions, because the sample is helpful, but it doesn't ask questions like, is this the first time this has happened to you? Because, you know, these are important questions. Like if someone faints and has sort of syncope and faints, you go, is this the first time this has happened? Oh, no, this happens all the time. Or yes, this is the first time. Or if they have a seizure, you say, is this the first time you've had a seizure? And they say, no, I have a seizure every week. You know, that changes the whole presentation. And so really taking a good history comes with experience. As a first aider, it's something that you're just starting out with, so you're going to want to have some sort of format. SAMPLE is a good example of that, so you can go signs and symptoms. So what are you feeling? What can you see? Then like allergies, medications. But when it comes to emergency medicine, we need to have a focused history, because we can't be bothered with other things that aren't important right now. What's important right now is what is the problem and how are we going to fix that. I hope that's really helpful. Just remember that there's books and books, and there's probably tons of videos on YouTube about how to take a super in-depth history, but really for a first aider, it's going to be SAMPLE. It's not a bad place to start. And then always just remember to ask the question, why did you call for help? Why did you want me here? Some people can take that the wrong way, but I'm genuinely saying, like, why did you phone? So that I can work out what I can do. Guys, hope that was helpful. Short and to the point. If you did like that, please hit like and subscribe, and we'll see you in the next video. Bye for now.